With humble pranams to the lotus feet of Mahaswamiji, I extend a warm welcome to everyone joining us today. Namaskaram to all our respected faculty members, healthcare professionals, students, alumni, and viewers joining us through our YouTube live session. As part of the observance of World Breastfeeding Week 2026, celebrated from 1st to the 7th August, JSS Institute of Naturopathy and Yogic Sciences continues its series of public health awareness programs with the global theme Breastfeeding for a Sustainable Start in Life, Strengthen What Works. Breastfeeding is much more than a method of infant feeding, it's the foundation of lifelong health for mother and child. Early recognition, timely support, and effective family counseling play an important role in helping mothers recover with confidence and continue their breastfeeding journey successfully. So, today's session aims to create awareness about these important aspects and encourages families to become active partners in maternal mental health. So, we are honored to welcome Dr. Shivaranjani, BNYS and MD Yoga Naturopathy, as today's speaker. Dr. Shivaranjani is currently serving as Assistant Professor and Medical Officer in the Department of Manipulative Therapy at JSS Institute of Naturopathy and Yogic Sciences, Coimbatore. She is a dedicated academician and clinician with expertise in yoga and naturopathy. Through her teaching, clinical practice, and patient counseling, she has consistently contributed to promoting holistic health and evidence based naturopathy care. So, today's topic is postpartum depression and family counseling. I'm confident that her insights will be valuable not only for healthcare professionals and students, but for mothers, families, and the general public. So, without further delay, I warmly invite Dr. Shivranjani to deliver today's health talk.
Good morning, everyone. I welcome everyone for this session. It is my privilege to speak on the topic postpartum depression and family counseling on behalf of World Breastfeeding Week. So the session is very important to understand and to support and heal the mother together as a family, and it is a public awareness session for the people who are watching this. Maybe they are the present new mother, or they are expectant mother, or a husband, a life partner, or a mother's mother, or a mother-in-law, or healthcare professionals who are willing to help the mothers in postpartum depression. So now we'll go into the session. So what we session is understanding postpartum depression. So what is postpartum depression and how it differs from baby blues? We'll come back to baby blues. Next is epidemiology in India. So what is the current prevalence rate of postpartum depression in India? And the next one is effect on mother and baby. So how the postpartum depression is going to affect the mother as well as the baby, and what is the link between the breastfeeding and the bonding to the postpartum depression. And next one is role of life partner. So this is a very crucial and very important thing in our session. So why the father's involvement matters the most in healing a mother who is facing postpartum depression. And the next one is family counseling. And this again, it is one of the main part of the session, how the family plays role in a mother, and how it will help the mother as well as the baby. And the next one is the common government apps or government helpline numbers which is available to help the mothers who are in postpartum depression. And along with this, as a part of breastfeeding week, as a contribution for the breastfeeding week, we will speak about the role of yoga and naturopathy in taking care of a postpartum depression mother and healing the postpartum depression of a mother. So, in postpartum depression, when we speak about postpartum depression, so postpartum depression, it is a clinical condition which can be treated, and it is a purely clinical condition. It is not the character of the mother, or it is not the fault of the mother in taking care of the baby. So that is the most important thing which has to be understood here. And so in postpartum depression, again, it is a treatable condition. It is not a personal failure or lack of love for the baby, and the mothers has to understand it is not the fault, or it is not the character defect of the mother that will affect the baby. So in postpartum depression, the first thing is baby blues. So this baby blues, it will be around 2 weeks from when it will start from the 2 hours after the delivery, and it will continue for around 2 weeks, and it is totally normal. The symptoms of baby blues will be like mild mood swings. There will be sudden burst of tears, sudden worries, and a very common thing which will resolve on its own after 2 weeks. And the reason why this happens in this postpartum spectrum is immediately after the delivery. Throughout the pregnancy, the mother will be undergo having their estrogen and progesterone level, which will be accessed through the placenta. So placenta will be the main thing which will be playing role in releasing the corticotrophin releasing hormones, and it will blunt the role of HPA axis. So immediately after delivery, when the placenta is taken out, the body will be in a state where the HPA axis will go under a hypo-responsive state. So immediately after delivery, the body doesn't know how to react to the situations. So the hormonal fluctuation will be in a sudden drop, and it will be in a sudden spike. And especially the systemic estrogen and progesterone level, it will be drop around 90 to 95% within first 48 hours. So this is the main reason where the stress response of the body will be in a stunned state for a temporary period, and the stress adaptation will be impaired. So this is the reason why the baby blues means the first 2 weeks of postpartum depression will happen. And once the body is getting adapted through the HPA axis, automatically it will revert back, and it will cope up to handle the stress hormones, the emotions of the mother. And when this go beyond the 2 weeks, when this baby blue, when this postpartum depression, when it goes beyond 2 weeks, then it is called as postpartum depression. So until that, it is called as baby blues, and which is very common. And postpartum depression, it will start from the 2 weeks, and maybe it will last for months, and maybe it will last up to an year. And the symptoms of postpartum depression will be persistent sadness. The mother will be continuously in a sad, hopelessness state, and they will not have any interest to interact with the family members. They will not have a bond with their own baby. They will not have a bond with their life partner. They will feel guilt for everything, and there will be changes in the sleep and changes in the appetite. And when we speak about the sleep, of course, after delivery, when a baby is born, the sleep will be deprived and sleep will be disturbed. The sleep pattern will be changed for the mother. So, uh, excluding the period when the mother is feeding the baby, even when the baby is sleeping, the mother cannot sleep in particular time. And even after feeding the baby, the mother will not feel hungry. Their appetite will be disturbed continuously for a long period. So these are all the symptoms of postpartum depression, and these symptom has to be noted by the family members. These symptoms has to be noted and aware. They should be aware. The mother itself should be aware of these symptoms, and these symptoms are to be supported and treated as early as possible. And coming to the very rare and sudden condition, which is called postpartum psychosis. So, this postpartum psychosis is a rare condition, and this will be like a sudden onset. So, there will be sudden confusions, hallucination, delusional thoughts, which will happen immediately after delivery with in the first few weeks or months. And it is very very dangerous for the mother as well as for the baby, where the mother, they themselves can hurt themselves, or they can hurt the baby, those who are undergoing postpartum psychosis. So the immediate medical emergency care should be given for postpartum psychosis. So now coming to the epidemiological review of postpartum depression, when we see in the Indian population, one in the four mother is affected by postpartum depression in the national population, and in a overall pooled prevalence, it is around 22 to 23.5 percentage of the population is affected by postpartum depression. And when coming to the comparison of the state level population, the southern states are higher in the prevalence of postpartum depression, which is around 26 percentage, and in northern state it is around 15 percentage, which is lowest from the southern state. And when we see in the hospital settings, when we compare the uh, mothers who are admitted in the hospital after delivery and the mothers who are discharged and taken back to their home, in that comparison, roughly around 23 percentage of the hospital setting, the mothers who are in the hospital setting are affected by postpartum depression, especially any complicated pregnancy or C-section delivery. Though mothers who have undergone C-section delivery are undergoing postpartum depression, comparing to the mothers who are being in the home after delivery. So these are all the prevalence which has been conducted from 2024 to till 2026. The meta-analysis was done to estimate the level of postpartum depression in the Indian population. And especially the Indian women's, another prevalence rate says that more Indian women are not even diagnosed with postpartum depression because they are not aware of the thing which they are undergoing, is postpartum depression and they are not treated. And the main reason for this is they are uh, educated or they are preached by the family members. Generation wise they are preached, mother has to undergo this, mother will undergo this, and this is the role of the mother. And that becomes a common thing where it is not voiced out, or where it is not diagnosed as postpartum depression. So, why this matters during breastfeeding week? Why do we want to speak about postpartum depression in breastfeeding week? It is so much necessary, and it is very important to speak about postpartum depression in breastfeeding week, because the postpartum depression and breastfeeding cycle, it is a bidirectional cycle where it will where the breastfeeding will affect the mother to undergo postpartum depression, and the mother who is undergoing postpartum depression will of course have difficulties in breastfeeding the baby. So the mother who is undergoing postpartum depression, they will be very low, they will be having low confidence, and their feeding routines will be disturbed, which will affect their milk supply as well as the let down reflex of milk. And why this happens, why this uh, breastfeeding dysregulation happens is the main role is played by the oxytocin, prolactin. The dysregulation in this oxytocin and prolactin will affect the breastfeeding cycle, because oxytocin again, it is a happy hormone, it is a love hormone, which will play a main role in let down reflex, so that the milk supply will be good. And when the mother is in a depression state, the oxytocin level will be reduced. So this reduced oxytocin level, automatically it will suppress the maternal bonding with the baby. So when maternal bonding with the baby is affected, automatically the milk supply and let down reflex will be reduced. And another thing is, when the breastfeeding becomes difficult, again it will add more stress to the mother, add more guilt to the mother, and that will worsen their depression symptoms. So the automatically the bonding and the timing of the mother and baby will be reduced, which will create a distance between the mother and baby, and which will create an aversion to feed the baby will happen in the postpartum depressed mother. So in here, we should support the mother, we should heal her, we should encourage her for the better relationship and better mental health for the mother and as well as the baby, which will help in the baby's nourishment through breast milk as well as the mother to overcome the depression. So here awareness is equal to protection. So once they are aware, once the surrounding, the family members, the life partners are aware that the mother is undergoing postpartum depression, they have to protect her, they have to support her through both physically and mentally to overcome the postpartum depression, which will support the mother to breastfeed the baby sufficiently and confidently. So, coming again to the Indian population, the common risk factors which is seen in Indian population is family and marital status, any marital discords, or any friction between the family members in a joint family, or if there is any lack of support from the life partner, from the spouse, or if the community or if the family members are preferring a boy baby, and if it is a girl baby. So all these factors which is resolving around the mother, all these family and community matters that will affect the mother's mental health. And the second thing is socio-economic status of the family. The low educated family members, or the low educated mother who will not be aware of the importance of uh, importance of taking care of her own health and importance of breastfeeding. And the second thing is the financial stress and the young maternal age. And this is a common thing which is happening. The young mother who are under 20, who are under 18, when they become mother, they are not aware of what is happening in their body and what is going around after delivery, and they are not able to take care of the baby themselves. So all these will affect their mental health as well as the baby. And the next one is first pregnancy, which is very anxious part of the mother, and as well as the woman who is undergoing the first pregnancy, first postpartum period, will be more anxious and more doubtful, and they will be less confident in handling the baby. So that itself will cause a depression, a fearful state. And when the family members, uh, when the life partner or the spouse around them are going to support them with their correct and adequate knowledge about the postpartum, that will help them to overcome the postpartum depression. And the next one is obstetric and physical risk factor, where the complicated delivery or previous frequent miscarriages, or the anemia. The maternal iron deficiency anemia is the most common reason physically, which is causing postpartum depression, where the mother themselves will be under a state of fatigue, under a state of generalized pain all over the body. And when along with this their sleep is deprived, it will affect their mental health, and again that is going to cause postpartum depression. And the next one is psychological history. If they are a depressive patient or an anxiety patient, or if they have any history of abuse, or if they have pregnancy related anxiety during the pregnancy period, if they had any anxiety disorders, all these has to be addressed even after the delivery, to overcome the anxiety or depression, and that will help the mother as well as the baby. And social isolation. So most of the mothers, and at present most of the women, they are not into a joint family like previous generations. So they are in a nuclear family, and working women, they are away from the city, and they are living away from their family members. So they are having less support in carrying over the role of taking care of the baby, as well as the home, as well as the mothers their own health. So again, this migration from their own place, migration from their own people, will affect the mother and their mental health. And the next one is sleep recovery. Of course, the mother will be having a disturbed sleep for first few months, and this inadequate sleep has to be compensated through the support of the family members. So, less than 3 to 4 hours of undisturbed sleep can be provided to the mother when the baby or the infant is taken care by the family members or the spouse themselves. So now coming to the ripple effect, what are the effects on the mother and what are all the effects on the baby they will undergo in postpartum depression. So when a mother is under a postpartum depression, she'll be having persistent sadness, guilt, self-doubt on her own ability. She'll be in a complete fatigue state, sleep and appetite disturbance will be happening, and there will be reduced confidence level in feeding and caregiving decisions. So the decision making of the mother will be always in a doubtful state in initial period, and this will automatically withdraw themselves from the family, from the friends and the support system around them. So in severe cases, the postpartum depressive mother, they can harm themselves, which has to be treated immediately. So these are all the effects a mother will be undergoing. When coming to the baby, so there will be delayed initiation, and the mother who is undergoing postpartum depression, of course, they will stop the breastfeeding early. So that will affect the nutrition and development of the baby. And the mother infant bonding will be reduced, and there will be high risk of growth difficulties. There will be changes in the milestone developments, and there will be it will also affect the baby's cognitive and emotional development, and this will greatly affect the nutrition of the baby's health. Yes. So now coming to a very important part of the session is the father's or life partner's role in postpartum depression. So one of the strongest protective factor against postpartum depression is a supportive and involved partner. So what are all the role a father or a life partner can do in a postpartum depression condition is share the load, share the load of the mother. So night feeds, let the mother to sleep and take the role of feeding the baby through pumped milk and making the baby burping after the feeding is completed, change the diapers, and take the household tasks on their own so that the mother can rest and recover. And next one is listen without judging. So do not judge the mother. So whatever they tell, whatever they feel, they will be definitely they will be sharing their feeling, and that has to be listened and addressed without any judgment. And do not make it normalizing, like it is normal after delivery. It happens to all the mothers. So all these words will make them more tired, and watch for warning signs of postpartum depression like persistent low mood and hopelessness, all these things, and make her recover from the postpartum depression. Take to the appointments, so do not leave her alone, and accompany the mother for each checkups and make her feel you're in support for her, and protect the space. When the family members or the community make choices, make decisions about the baby and the mother, support the mother and protect her from the community, and normalize seeking help. So always encourage the mother to seek help whenever necessary, and do not feel guilt on asking help. Now coming to the family counseling. So family counseling, it is a whole household approach. In India, the joint family often shapes the postpartum experience, Counseling works best when it includes psychoeducation for all the family members, the mother-in-laws, parents, partners has to understand the uh, understand what is postpartum depression without judging the mother, without judging the character of the mother, and improve the communication. So do not blame the mother, do not criticize them, and do not expect an unrealistic changes, unrealistic happenings immediately after the delivery. So rebalance the household roles. So redistribute the role of the household works to all the family members so that the mother can get rest and recovery. Bridge to professional care. So encourage the family to consult ASHA workers, PHCs, obstetricians, or a psychiatrist whenever they notice the symptoms of postpartum depression. And the last one is sustain long-term support. So always support the mother in initial weeks after the birth. So now coming to the role of yoga in recovery of postpartum depression, there have been recent studies, randomized trials in India, which was conducted for postpartum women in Tamil Nadu for 8-week yoga program. They have seen greater reduction in the depression, anger, and tension for the postpartum woman after doing gentle asanas, pranayamas, relaxation techniques, and the gentle asanas after few weeks, after around 6 weeks, where usually around after 6 weeks of vaginal birth or around 2 months or 3 months of C-section delivery, the mother can start the gentle asanas, few stretches to relieve her joint stiffness, to stretch the muscles which are stiff so that the tension around the body will be reduced. And pranayamas, Nadishuddhan pranayama, Brahmari pranayama will calm her nervous system. It will rapidly reduce her heartbeat. Whenever the mother feels exhausted or deprived or depressed, she can do a common practice of deep inhalation and a longer deep inhalation through our nose and longer exhalation through our mouth for 3 to 4 times, which will rapidly reduce her heartbeat and which will change her body from sympathetic uh, driven system to the parasympathetic state, where the flight and fight mode will be changed to rest and digest state of the body. And again, gentle movements along with the infants will create a bond between the mother and baby, so which will help to have a great bonding, and as well as the anxiety, stress, and depression will be overshadowed by the bond created to the baby. So in naturopathy and lifestyle changes, the whole person is supported to get recover from the delivery. And the first thing is sunlight and vitamin D. A short walk in morning sunlight daily, which will boost the mood of the mother, and a nourishing diet balanced with omega-3, B vitamins, iron, folate, all this will support the brain health and give a energy boost for the mother. And whenever they feel depressed or whenever they feel anxious or whenever they want some physical energy, they can undergo hydrotherapy treatments like warm baths, gentle massage, and protect themselves from the depressive state both physiologically and psychologically, uh, by hydrotherapy and manipulative treatments, and sleep protection. An uninterrupted stretch of sleep for a shorter period itself will play a great role in aiding the support of the mother's mental health. And time in nature. So spend time in nature by taking fresh air, walking in a green space, even in a balcony or a terrace, to gently lift the mood and change in environment, which will refresh the mind of the mother. And last one is community and ritual, where the traditional postpartum care has to be confined uh, to that, which will give comfort and support to the mother, has to be undergone. All other whichever is affecting the mental health of the mother has to be avoided. And this again, it is one of the help helplines available in India, for not only for mother, whoever is undergoing any mental health issues, they can use these information. Telemanas, which is a portal of government of India, and iCall, and your local ASHA, ANM or PHC, they will give a support for your mental health. So from this session, the key message which has to be carried to the home is: 1 in 4 to 5 mothers are undergoing postpartum depression, and it is a common thing. It is not a rare condition. It is not the fault of the mother. It is not the character bias of the mother. And second one is postpartum depression. It is a medical condition which can be treated with the right support, and it is not a weakness, and it is not to be thought as a uh, guilt or uh, fault of the mother, which will be affecting the baby. And the third one is partners support matters the most, which is the strongest protective factor. And the fourth one is family counseling, involving the whole household in household works, which will help the mother as well as the baby to overcome the postpartum depression. And yoga and naturopathy plays a major role. It is a complementary and evidence-based practice alongside of the counseling, which will help the mother to overcome postpartum depression. So this World Breastfeeding Week, let's support the mother behind the mother, her mind, her body, and her family circle. So when to seek professional help is when the postpartum depression is lasting beyond 2 weeks, for months, or for an year, when the mother has lost her interest in her own baby or everyday activities, when the mother is persistently feeling guilt or feeling themselves as a bad mother, when they are under severe anxiety, panic attack, when they have trouble in the sleep, even when the baby is in sleeping, and any thought of harming herself or the baby, immediately seek the help of professionals, where they will be using an Edinburgh postnatal depression scale, which is a simple validated questionnaire used in Indian clinics, ASHA, and ANM workers to screen new mothers whether they are under postpartum depression or not. So, once again, I wish all the mothers, expecting mothers, a happy World Breastfeeding Week, and thank you.
As we come to the close of today's enlightening session, it is my privilege to propose the thanking note. So, on behalf of JSS Institute of Naturopathy and Yogic Sciences, I express my sincere gratitude to our esteemed speaker, Dr. Shivaranjani, who, for delivering such an informative and thought provoking talk on postpartum depression and family counseling. The session was very valuable and have highlighted the importance of recognizing the maternal mental health, strengthening the family support, and ensuring a healthy and a sustainable breastfeeding journey for mother as well as child. So, we all, also extend our heartfelt thanks to our principal, Dr. Dilip VR, faculty members, organizing committee, and all those who have worked behind. So our sincere appreciation to all the participants who are viewing our session too. So as we continue to observe World Breastfeeding Week 2026, let us remember that supporting mothers is a shared responsibility. Stay with us on tune for the next few more days till 7th of August for informative sessions. Thank you all.